the project itself came from nothing. It was a poor neighborhood that nobody had ever heard of. And we as a community decided, hey, we need to do something to help people that don't have access to a doctor. It's become a source of pride for the neighborhood. Denver Harbor feels like this is their clinic, and it belongs to them. And that's the way, I had always envisioned it. This isn't my clinic, this is the neighborhood's clinic.
We started at the church, and we were working just one day a week. And it was one doctor, myself, and a receptionist. We started putting more services and more programs in there, and people been coming. And we've been having a lot of visits daily.
For us, it's much more than just a job. It's a responsibility to the people that we see, and that we know that if we're not there, there's nowhere for them to go.
We don't care if you're the richest member of the society or the poorest member of society. We think everybody, as a human being, has a right to be treated well, and we're going to do that.
It's remarkable that over the last 15 years, we went from having nothing, no facility, no buildings, to an organization that sees 10,000 patients a year.
We have people coming from a long distance, people that come from Humboldt, from airline, from all over the place. We full. We full. And it's like a dream come true.
It was a community of working people who did not have the benefit we have of having an insurance. And being able to have a clinic there that they could go receive excellent care and pay for it based on a scale was very attractive.
When we first started at Denver Harbor, it was a family medicine center. We provided primary medical care, and we added dental very quickly. We added mental health very quickly. We've had to add numerous mental health providers because that service line has grown so much.
A lot of our patients go through a lot of struggles. Poverty comes with a lot of stressors. So to find a place where you can go and they will understand you, they will treat you with respect, it just creates that loyalty.
We're in second, third generation of families that we've taken care of. People trust us, and the care we provide, it's not a lower level of care because it's poor people that are getting it. No, it's the same quality care that anyone can get anywhere in the city.
Vecino is unique in that they're a pioneer in this industry, which is defined as Federally Qualified Health Center, FQHC. They're an idea leader in this space.
The difference is night and day between what a member of the community can get in terms of health care at a federally funded community clinic that used residents versus some private physician.
You don't have to go to the Texas Medical Center to see these Methodist physicians and Methodist residents. They're available to you in a really accessible way.
It works for the patient, it works for the doctors, it works for doctors in training, it works for the community there. This really, really works.
That has become a model now for many other federally funded community clinics in the country that say, gee, this is good. They want to do the same thing.
The big game changer for us was when we opened the Airline Children's Clinic. That has been the financial driver of our organization. And what that did is it changed us from having to raise money to keep our doors open. Now we're going to sink or swim on how we take care of patients. And I guess we can't ask for more than that.
We've reached capacity at both clinics. Word's getting out. People are actually coming in to the Denver Harbor neighborhood, to the Children's Airline Clinic. So now we need to raise the funds and start building.
$2.3 million expansion. This facility right now is about 5,000 square feet. We're going to double the size. We'll have another 5,000 square feet outside, and then we're going to renovate the inside. So when we're done, we'll basically have a new facility. It'll be state of the art. Also expand the Denver Harbor location. It'd be another 5,000 square foot expansion. And then we've got a great opportunity with a new partnership with Neighborhood Centers. Neighborhood Centers is opening a 45,000 square foot campus in Aldine. We're gonna have 6,000 square feet there.
From an operational perspective, we're almost fully funded by the revenue that's generated by patient visits. The philanthropic part of it, we really want to use those funds as growth capital, and that's the goal.
Foundations want to give to agencies that are not only innovative, but that are consistent. And so foundations give to us because they know they're not giving to keep the lights on. They're giving to grow. They're giving to expand our services to other communities.
It's been small donors that have made this happen over time at the foundation and at the individual level. I would tell people that small donation from an individual means as much to us as a large donation we get from a large foundation.
Any contribution I make to Vecino, it comes back to the community many-fold in a very, very positive way. And so, that's the picture I get when I write the check.
And now, when we're going through the middle of a whole anxiety period, what the heck is going to happen to our healthcare system? What a better timing to talk about a model that is very successful today, right here in Houston.
If we're good at our mission and we're seeing people, we're getting them healthier, people do better on the job, the economy improves, and that's better for all of us. I think we all want to leave our community better off than we found it. The Let Health Shine campaign is an opportunity to do it. Let's concentrate on how can we make Houston the greatest city in the country.